To be honest with you, I've seen it work. I've seen it work, and you can even get a cavitation occasionally out of it. But the problem is usually when they're acute, they're really painful, and they don't like to activate that guy. So, you know, it's one of those things that's certainly worth a shot. Again, I'd rather manipulate it, talk them into manipulating them, and just hammer it that way. But, you know, sometimes you can't. Person's pregnant, whatever. Of course, pregnant usually can't lay on their belly. So, the technique, if it's on, so you're going to take the ipsilateral side. All you're going to do is come in mid-thigh. You're going to stabilize here, have them extend, raise up your leg, and then hold and resist. And that's all it is. And what you're hoping is that multif, remember we did that test that Troy said to find the multif if it's contracting, and then I gave you the sequence thing. All we're doing is using those deep fibers of the multif that are attached to the joint capsule, remember we talked about that in anatomy, to kind of pull that joint and separate it, if you will. It's worth a shot. It's easy. I don't know. I'd rather manipulate. But there's the technique. Okay, so we'll do that one. And the other one is a lateral shift, if I can get you standing. When we do our segment on McKenzie, I think we still have that in here, don't we? We talked about Ron Schenk, propped him up a lot, and I was just telling Troy that I've used a lot of the stuff in the updates course that he taught us for the lateral shift correction, and we do that and you probably know, probably in prone, lateral shift correction with extension and all this sort of stuff. And it's just great stuff. This is just a generic lateral shift. You have the patient's elbow at the side, and so if they are shifted, there. So I'm going to kind of block with my shoulder, keep my spine in a good angle, and I'm going to bring them towards me slowly and hold. I like to add the breathing component to it, get some reflexive inhibition possibly. I'll use whatever I can get. Go slow, hold. This may take quite a while. It may take a minute, 2 minutes to do. They can do this at home, putting their up against the wall and moving their lower body to the wall. And then what you want to do is once you get that corrected, so if I get them, let's say I can get them to here, and what I like to have them do is give me a pelvic floor contraction, which I've already taught them how to do. No, not a posterior pelvic tilt. Just pull the boys up inside you. There you go. Give me a little bit of a transverse abdominis, kind of pull that belly button in. Good. Now breathe. And then I'll let go slowly, and then try to let that kind of help hold. Use some of the stabilizers to help hold that. Okay? And that's kind of what Ron was talking about a little bit, kind of mixing the McKenzie with the stabilizational stuff. Then slowly have them stand there and then progress to walking. And usually by 3 steps, they're boop, back. So it takes several episodes to repeat. You know, just a quick story. When I was a younger therapist,